Good morning everyone, I am Dr. Murali Chand from India. Now I am going for a surgery of CSF Rhinorrhoea. Let me explain the CSF Rhinorrhoea in a simplest way. More than 90% of the times, this CSF Rhinorrhoea, small meningocele, present medial to the middle turbinate at anterethmoidal artery entry zone into the cranium. So, more than 95% of the times it present medial to the middle turbinate at medial lamina of the cubriform plate. So what Dr. Satish Jain says is always resect the middle turbinate. So I did the same thing in all the cases, and then expose the total ethmoidal area and the frontal recess and the sphenoidal area. So in that way we may not miss the other areas also, other areas of CSF leaks. So most of the times, more than 90 to 95% of the times, you can appreciate the small meningocele medial to the middle turbinate at entry zone of anterethmoidal artery in the medial lamina of the cubriform plate. So what you have to do is take a bipolar cautery and just buzz it, just cauterize it. It will shrink. So many times. So take a bipolar forceps, and cauterize it. When the CSF leak is sealed, just keep a fat, small abdominal fat, and apply the release seal or any tissue glues, and then small Surgicel, and again some seal, release seal or whatever it may be, and then always keep the Haddad flap. It is very simple. I have done so many cases. This Haddad flap works wonders. So, in simpler way, bipolar cauterization, and another thing is remove the mucosa at least 1 to 2 centimeters surrounding that lesion, and release small abdominal fat, plug it with ball probe, and release seal, Surgicel, release seal, Haddad flap, release seal, and finally you stabilize this with gel foam. That's it. When there is CSF leak, even after cauterization, then take abdominal fat along with the fascia. This is what I want to stress. When there is CSF leak, still leak after cauterization, take abdominal fat along with the small fascia and plug it. This fascia along with the fat, it stabilizes the fat. What happens is, when you take only fat, when you are trying to plug the leak, it may come down or it may not be stabilized. So when there is still leak even after cauterization, bipolar cauterization, take abdominal fat along with small fascia and plug it. Again the same thing. Keep the release seal over the fat and Surgicel, again the release seal or any seal, simple seal, cheap seal. Cheap seals also works very well. And Haddad flap, release seal, and again stabilize with gel foam. That's it. But usually Dr. Satish Jain advocates fascia lata. But I have done all the cases with Haddad flap. It really works. I didn't get any recurrence. If you don't have money for this release seal, or any seals, if the patient is so poor, you can just centrifuge the blood. In the middle, you can get, in the middle column, when you rotate more than 2 to 3 minutes at 500 rpm, 5000 rpm, in the middle you will get platelet rich plasma, 3 rp. You can use that. It is very sticky. So in a simpler way, bipolar cartridge, any seal, Murali seal or whatever the seal, bipolar cartridge, fat, Murali seal, Sagicel, Murali seal, hard Murali seal, stabilized with gel form. As simple as that. Even in multiple leaks also, this hard works very well. Even in post-traumatic cases where extensive leaks over the total with model area, you can use the same hard flap. So what I feel is this hard flap is really wonderful. It's simple. Let us make CSF Rhinorrhoea very simple. I think this hard flap is the solution. Thank you.